Welcome back to KSLA News 12 at 4. Families are often unprepared to deal with the challenge of long-term health care for elderly parents. Now, whether you decide to care for them at home or place them in a facility, these decisions can be overwhelming, especially if you don't have the information and resources that you need. So that's why we are here to help today. Joining me now is Jennifer Kimball of Proactive Nursing Solutions to kind of give us a little information. So thank you so much for sharing your time with us today.
Thank you for having me.
Well, let's talk a little bit about your history and your experience that you have, because you provide senior care management services, so you know firsthand what the process is like.
Yes. This is actually my 36th year in healthcare.
A little experience, okay.
It's been a while, and I am a registered nurse, and my board certification is in gerontology because my passion has always been for working with seniors. Don't know why that happened, but it's always been that way. My work experience really has covered rehab, hospice. I've been the director of nursing at some local nursing homes, and in the process of all the things that I've done, the things that I've learned and seen, nothing that you would learn in school, I've seen the people that kind of fell through the cracks, and wanted to put something together to give an available opportunity for families to have someone to call, not home health, not something that you traditionally see coming out of a hospital or something, but someone like that family member that they just don't have available that can manage all of their care. So that can encompass health issues, clearly, and it might even start from maybe a new medical issue or some chronic condition that is worsening. Because of course, I think first thing you think about with a nurse is health conditions. But I might be as likely to be planting a garden or fixing a coffee pot for someone as I am at a doctor's appointment with them or at a procedure. So you consider the things that you would do for your elderly parent or loved one. And if you're not available to do that, if you don't have anybody that can step in, or if you feel unequipped, or if you're in the sandwich generation and you're raising your own family,
Right.
and you just can't physically manage all the time and energy that goes into having to do what you do for your elderly parents, then you call someone for care management, and that's where I step in and try to take over and become that family member. Oftentimes it may be for someone who doesn't have a loved one in town,
Right.
but it doesn't have to be. They can have someone living right next door. But if they just don't feel equipped to help their loved one maintain their quality of life with physical and health needs and with social needs even, and whatever it is that they enjoy that brings them pleasure, if you feel ill-equipped to do that, or you just don't have someone available, then certainly that's where I step in.
That's where you come in. And going back to your 36 years of experience, you've seen probably every situation that there is out there, but I'm really glad that you mentioned so often this goes beyond, just the physical health care of getting somebody up and making sure that they're getting the exercise that they need or that their medication is ready. A lot of the times that the issues we see is the self-isolation. If they don't have a family member there or somebody who is close to them, helping them get out and having that mental stimulation and having a conversation with somebody can be so crucial.
Yeah, just simply having a cup of coffee with someone.
That social act.
It's absolutely so uplifting. Or having lunch with somebody, or taking them, I have a gentleman who loved to garden, and we, at his facility got permission and put together, we planted whatever he wanted to plant. And we did this, we visited that garden every time I was there. May not be every day, but we took care of that. And he went and was able to weed the garden. He couldn't do everything, but with my assistance, he was still able to enjoy the things that he did growing up. And when he grew up on a farm.
That's a big part of it, is because I think so often somebody who may be in a facility or somebody who may be in need of your services, they feel forgotten. They feel overlooked because we're all going through our day-to-day routines. It's easy to forget about something that gardening that is so passionate to somebody who's been such a big part of our life.
Absolutely. And everyone wants to feel like they have a purpose. They want to be able to do something they can succeed at. That doesn't stop when you age. It doesn't stop when you relocate to a facility. We still want that. We have that. We certainly want to take care of our health, medical, physical health. But our mental health is certainly just as important to enjoy a quality of life. And then we may have people who, families that just need a little consultation for what am I going to do? I'm not prepared for this. I don't know what long-term care is about. How do I check out nursing homes? What do I do? And I'm happy to do that and be there one time for them. Anything to help them in this process going into long-term care. And helping to better the quality of life for someone who might not otherwise have that opportunity.
Right. You are such a blessing, Jennifer.
Thank
you
you
for sharing your time with us today, and thank you for sharing your services with our community. We have all of her contact information up there on the screen, including the website. Now, this is vital information for people who are facing this challenge, and we really appreciate you being here with us today.
Thank you for having me again.